There we go.
You can see the thing. Good morning. This morning, I'd like to introduce the lovely Dr. Alison Merrick. Alison has been a member of LWO since our very early days, and she joined us in July 2014. Gracious me. Alison, tell us a little bit about yourself, please.
Good morning, Gaynor. Well, thanks very much for asking me to begin with. So a little bit about my background. I was trained up as a researcher, a medical researcher, and I worked at St James's Hospital in Leeds in the north of England for about 10 years as an immunologist, working on developing immune therapies for cancer. So that was a really interesting job, and I loved it. And what I was particularly drawn to was when we were developing and running early clinical trials. And in that role, I did have quite a lot of contact with patients. So patients that we were enrolling into trials who wanted to find out what was going to happen to their samples and things during the trial process. And so I would go in and chat to them about what we were trying to achieve. And I really enjoyed that one-to-one contact with people because obviously the rest of my job was very much at a lab bench. So when I decided to make a career change for various reasons, I wanted to go into a therapeutic role where I was working with people one-to-one, but I was doing something that was actually remedial and helpful. Well-being and things is great, and I think that's really, really important, but I actually wanted to be doing a physical therapy that was going to be able to change things for people. And I'd done massage and things like that for many years, and because of my interest in the immune system and therefore the lymphatic system as well, training as an MLD therapist was had a big draw to me. It was really, really interesting and fascinating. And so I trained with the Vodda School, and the rest, as they say, is history. That's about 11 years ago now. And so I've been working as an MLD CDT therapist since then. I'm loving it. It was one of the best things I've done.
Great, that's absolutely wonderful. Living with lymphedema is a real challenge for people like me, and mine isn't as obvious as most people's. Do you also find the lack of knowledge amongst other clinicians frustrating, as we do?
Yes, I have to say so. Where to start with that? Well, obviously, historically in this country, we've not been great at actually educating our doctors and medical personnel on the lymphatic system at all. The background that they have in their training on the lymphatic system is zero or very little. Mm-hmm. Historically, I think there was, on the one hand, there was a fear of the lymphatic system, and on the other hand, there was a, well, it's not important, so let's forget it. And I think that has been propagated throughout medical training for quite a number of decades, if not the last century. We are a little bit different in this country from other countries, I think. For example, Germany, as we know, the lymphatic system is very important, and it's a big part of their training and their treatment. For example, I think I'm right in saying that the physios in Germany have to do MLD training. It's a part of their training, so it is an integral part of their system. Here it hasn't been. So I think it has taken a long time for GPs to start catching up on what is a wide problem and affects a lot of people. The other side of that is that I think that it's not recognised as being as widespread as it is. And also, as something that happened post-cancer treatment, I think there was quite a bit of attitude that, well, if we've cured your cancer, you should be grateful for that, really. And if there's any fallout, well, that's kind of tough, but you're still alive. And I know that sounds really harsh, but I do think there was quite a lot of that attitude. But I'm thankful that in recent years, I do think things are starting to change. Kind of 10 years ago, I had a real problem with getting GPs to actually take me seriously and listen to what I was saying. In the last 3, 4, 5 years, they've been getting much better. And now if I can, thankfully, I can refer people to our local lymphedema service in the NHS here, and they refer people to me. That's a bit unofficial, but they do. And GPs now they recognise my name, they take me seriously. If I send in measurements and a covering letter, they will prescribe on my say-so. So I do think, I'm talking to other NLD therapists in the country as well, I do think that's improving. But yes, it's a very frustrating thing, and I think it's a very demoralizing thing when you're a patient who is going to your doctor repeatedly saying, I've got a problem, I need some help, and they're quite dismissive. So, but I'm hopeful that is changing.
Yeah, I couldn't agree more. I mean, when I was first diagnosed in 2011, I really thought I was speaking to people that had just kept putting a brick wall up. And now I'm finding more and more people are listening to what we're having to say. I also think, I know patient advocates have been around for a long, long time. There's always been somebody fighting the cause somewhere. But I do think patient advocates are now beginning to be, I feel we're beginning to be listened to more than we were before.
Yeah.
But it all takes time, and just pushing, it seems to be you're pushing all the time. How did you find joining LWO as a therapist? And how has it been beneficial to you?
Well, I think very early on in my work with people with lymphedema, I actually found that I was learning massive amounts from people who were living with it, which is the same probably with a lot of chronic conditions. People are interested in keeping themselves as healthy as possible. They do a lot of research, they try things out, they try different diets, they've tried different compression. And so the feedback that I was getting from my clients was so invaluable, and things that I couldn't really learn in books or from research. So joining something like LWO, where there's an awful lot of people who are asking questions, sharing their knowledge, very generous with their knowledge really, and taking time to answer people's personal questions and things. I think for me, it's been invaluable. I mean, I hope that I've helped with a bit of input as well. But for me, it's the learning side of it, which is really been an invaluable thing to me, because I can pass those things on to my clients too. I can't necessarily say, yes, do this, it's going to work. But what I can say is there's quite a lot of people out there that have tried this and it's worked for them. And that's really useful, because a lot of the medics, they are confined by, things that have been researched, things that are out there and have been published. And that's great when they do get to that point. But there's an awful lot of things that are around for years before anybody publishes any kind of research about it. And we need to know about those things. And that kind of sharing is just invaluable.
Yeah, I mean, our ethos has always been to give our members a voice. And we're all different, and we all react differently to the lymphedema we have. Yeah. And I think it's important. Yes, there has to be a general consensus of the way we treat, but I think everybody's an individual, and trying to get through to them that they have a voice, because I think a lot of them feel that they do not have a voice. And that when they talk about lymphedema, nobody's listening. And I think they find that really frustrating,
Yeah.
So what insights do we gain from all working together, do you think?
I think, as I've as I've already said, about sharing. And because I try to look at people quite holistically, I think within the NHS, they're quite kind of focused on individual areas,
Yeah.
and it is hard for them to look at people as a whole. And so I think any knowledge that I can get on a wide range of areas, so not just about, you know, the massage and the compression, but also to do with, you know, what kind of exercise people can cope with. You know, do they recommend a specific rebounder that's really helped them and it wasn't too expensive or whatever? You know, dietary things. What kind of diet has really helped people? Is there anything that's particularly improved their swelling? You know, medication. I mean, we do know that some medications will make swelling worse, but some, it's a bit of a grey area. And just having that experience to say, well, okay, maybe it'd be a good idea to go and see your GP and see if you can have those blood pressure meds reviewed, because that seems to be making things worse at the moment. And, you know, I know from LWO that, you know, there are other people out there who are saying, yeah, this seems to have made things worse for me. So I think all of those things are really valuable. I mean, obviously, I never tell anybody you must change your medication, but I often do recommend that people go for a review to their GP or to a pharmacist to say, is there anything here that could be causing me problems? Is there anything that could be improved? And all of those things are really useful to know.
Yes, they really are, aren't they? Again, it's giving our members, I think, the chance to decide for themselves. You know, if we can talk about different topics and then say, but at the end of the day, the choice is yours. You know, and trying to get through to them that you know your body better than anybody else.
Absolutely.
And that's the principle I think we've always worked on, apart from the fact we don't diagnose. And I make a big point of saying we don't do that. Ask questions by all means, but then at the end of the day, you must go back to your clinician.
Yeah. Absolutely. And I'm the same in that I can't diagnose either. But I can certainly recommend and refer people if I feel that they need seeing. I mean, one thing I can see is I have the background to be able to see if I think that there's a real problem and there needs to be some medical intervention. And then I will always say, yes, you need to go and see your GP, or you need to go and have a word with your consultant. And yeah, we all need to be careful of that, don't we?
Yeah, absolutely. And finally, we've done quite a few Zoom sessions. I hope we're going to do some more this year once we get WLD out of the way. What advice would you give someone who was newly diagnosed?
Okay, so it does vary a lot from one part of the country to the other, what kind of support that you're going to be able to get. I'm really fortunate where I live that we've got a really good lymphedema service at our local NHS hospital. I know that this is not widespread throughout the UK, but certainly I would recommend that that's the first place that you should look to see if there is anywhere locally where you can get services. Now, it varies. Some places don't have any coverage at all. Some places will just do post-cancer lymphedema. Some places will cover everything. I do think that people that have primary lymphedema tend to get overlooked quite a lot. Because they're not a priority, and they're often a group of people that have had the condition for many, many years without having had any proper diagnosis or help. And they actually, I think at the last count, I think they accounted for about 75% of lymphedemas in this country. So we're talking about a massive group of people. But yes, go to your local lymphedema service if there is one. If there is nothing available locally to you, you could try looking for a more distant referral to see if there's anywhere within travelling distance, because you should be able to still be able to access that through the NHS. Now, if none of that is available to you at all, then I would suggest trying to contact a local MLD CDT therapist. You can look on the website MLD UK to find somebody that's properly qualified. And what I have found is that even if you really can't afford to pay for a lot of treatment for yourself, a lot of therapists like myself will try their best to accommodate you within what you can do and what you can afford. So have a word with them, try and have a couple of appointments with them. They can measure you, they can hopefully get your doctor prescribing things for you, they can give you exercises and skincare advice. If you do need CDT, which is the whole bandaging thing, you can usually get bandages and things on prescription from your doctor as well. And they can teach you a lot of self-care and things. And so even with minimal contact with a good therapist, you should be able to get quite a lot of support. And obviously, if you have the finances to be able to do it ongoing, I do have a lot of people that come to me for regular support and they find it invaluable. And also, I think the private therapists, we have more time, you know, and I think being able to listen to people talk things through with people is an invaluable thing to offer.
Yeah, that's absolutely great. Well, Alison, it's been a real pleasure talking to you again. I hope we'll do this more often in the future, and certainly some Zoom sessions later in the year. Thank you very much. Thank you, Dr. Alison Merrick.
Thank you, and thanks very much for asking me, Gaynor.